Assalamualaikum warahmatullahi wabarakatuh. So we are from Group D. We present our case study regarding central retinal artery occlusion.
Before I continue, my name is Farhana Afika binti Ahmad Rashid with metric number 1913458. So, what is actually central retinal artery occlusion or CRAO? Central retinal artery occlusion or CRAO is the sudden blockage of the central retinal artery resulting in retinal hypoperfusion, progressive cellular damage, and vision loss. It causes sudden, painless, unilateral, and usually severe vision loss. And embolism is the most common cause for CRAO. Three main types of emboli are cholesterol, calcium, and platelet fibrin. Both cholesterol and platelet fibrin emboli typically arise from atheromas in carotid arteries. So, who is at risk for central retinal artery occlusion? High blood pressure and aging are the main risks for CRAO. Diabetes can also raise your risk. In these cases, this patient had history of coronary artery diseases, which is high blood pressure, due to he said that before he had undergone an endovascular stenting of the left carotid, which is on the same side with the structure that affected in the left eye. So, regarding our case study, what is happening at both eyes? For the right eye, most of the tests shows a positive result, only that there is a reduced vision of the patient, which is 6/12, due to the mild nuclear sclerosis, which is common among elderly. For the left eye, we can see that there is an enlargement of the optic disc from the normal size. The swollen optic disc, which may be due to the increase of intraocular pressure in the eye because of the low mean blood pressure in the retina, optic nerve, and choroid. Thus, the patient experienced sudden vision loss in one eye, which is his left eye, as the eye does not get sufficient blood supply from the central retinal artery. Next, we can also see that there is a cherry spot at the macula area. It caused by the opacification of the nerve fiber layer as it becomes edematous from ischemia. Last one is there is a narrowing of blood vessels compared to the normal person. The visual field of the patient's left eye is limited due to the constricted blood vessels, which results in the lack of oxygen to the affected area at the retina. In addition, the medication and drugs intake may also affect the blood vessels constriction because the medication intake of the patient causes the blood clot at small arteries, thus making the blood vessels in the eyes become constricted.
Okay, hi, my name is Nur Atika binti Yusuf. I will explain about the symptom of this case study. The patient have sudden painless loss of vision in one eye, which is in left eye, and the vision loss usually in the range of counting finger to hand motion. From the symptom, the structure that affected is in the central retinal artery, CRA. This structure will provide main nutrient to the retina, and retina is the layer that will sense the light and turn it into the electrical signal. If one of the vessels that carry blood into the retina get blocked by clot or plaque, our optic nerve cannot receive the electrical signal and thus can cause the vision loss. As a result, the left central retinal artery is affected as patient have vision loss in his left eye. Besides central retinal artery, the swollen optic disc also one of the ocular structure that affected due of intraocular pressure, IOP. is increased. This will affect the low mean blood pressure in the retina, optic nerve head, and choroid. Thus, the patient experiences sudden vision loss in one eye, which is his left eye, as the eye does not get sufficient blood supply from the central retinal artery. From these two symptoms, we know that the patient only can see when doing hand motion, as his vision has reduced. Next, we go to the best fitting diagnosis for this case study. My group has agreed that the patient have central retinal artery occlusion based on the symptom, sign, and history that been taught in this case study. Justification. Number 1. Patient had history of coronary artery disease, which is high blood pressure. Second, the medication intake may also affect the blood vessel constriction because it gives another side effect, such as it causes blood clots at small artery. Third is a pupillary response test, and fourth, reduced vision. Firstly, this patient had history of the coronary artery disease, which is high blood pressure that we predict. He said that before he have undergo endovascular stenting surgery of left carotid artery, which is same side with the structure that affected in the eye, which is left central retinal artery. Second, regarding of the pupil response, the pupil who had CRAO will respond badly to the any direct light, but constrict briskly the another eye is illuminated. It is the because why the result RABD is positive. Besides, the occurrence of vision loss is unilateral and painless, as stated by the statement, is a common sign of the central retinal artery occlusion.
Okay, Assalamualaikum. My name is Ilfil Hafiz, and I will talk about the general management of this disease. Okay, the first indication to treat this disease is by using the vasodilation method. Function to increase the blood oxygen content in our eyes. We can use the carbogen therapy technique, which means carbogen is actually a mixture of oxygen and carbon dioxide. It's believed that carbon dioxide can prevent the oxygen-induced vasoconstriction. As it prevents, it will increase the blood flow in our vessel while maintaining the oxygenation at the retina part. But the result of the recovery from this technique was not significant yet. Okay, we move on to the second method, which is the reduction of intraocular pressure, or IOP. Okay, what is IOP? IOP is the pressure inside the eyes. Okay, as IOP decrease, when IOP decrease, it will increase the ocular perfusion in our eyes. Perfusion is like the arterial blood flow. Okay, the technique that we can use by this method is digital ocular massage, as I provide the picture in the slide. This technique is like something like that. Okay, digital ocular massage will cause the retinal artery to dilate. As it dilates, it will create the large fluctuation in the IOP at our eyes. This technique also can annihilate the thrombus in our eyes. So it's thrombus. Thrombus is actually a blood clot that forms in the vessel in our eyes, and it remains at the same place. Okay, the next method that we can use is by consuming drug or medication such as acetazolamide. Acetazolamide is like a pill, like the picture in the slide. This pill is effective to control the fluid secretion. It will reduce the aqueous production in our eyes. So as the aqueous production is dropped or low, it will also decrease the intraocular pressure, or IOP. Okay, as we know, as the IOP decrease, it will increase the ocular perfusion or retinal circulation in our eyes. Oh, I forgot to mention that this method only for a short-term therapy. Okay, the last indication is the surgery, or we call as the anterior chamber paracentesis. It's conducted by inserting a needle into the artery chamber via the limbus, and the function is to withdraw the aqueous fluid from our eyes. As it withdraws the aqueous fluid, it will cause a dramatic drop in the IOP and will cause the dilatation of the retinal arteries. As we know, IOP drops, so the retinal function will increase. Okay, to add on, even with those treatment, the improvement in the visual acuity is rare. Usually, the patient only have a hand movement or the light perception vision. Okay, there are also evaluation on the possibility or outcome to treat this disease, but the result is low. That's why we must take a fast precaution step after the symptom occur. And the lifestyle is also a prevention step to treat this disease. We all know that this disease caused by the blood clot in our vessel and that caused by our food intake. That's why we must eat a healthy diet and we must exercise regularly. Okay, I think that's all from us. So thank you. Share.